Well, the province is asking people not to get tested unless they are showing symptoms of COVID-19. But what if you're transmitting the virus without even knowing it? Studies suggesting that about 30% of patients positive for the coronavirus were asymptomatic, meaning they didn't know that they had this virus, weren't displaying any symptoms, possibly increasing then the risk of transmission. So how do we combat all of that? City News web writer Dilshad Burman speaking with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey, in their weekly Ask Me Anything session. Dee Burman joins us now live. Good morning to you, Dee.
Good morning, Mel. That's right. I've been speaking with the Associate Medical Officer of Health every week, and our viewers and listeners have been submitting their questions. And so this week we had a question about, like you said, asymptomatic testing. Early on in March, we were told, don't go to get tested unless you have symptoms, cold, cough, fever, something like that. Then as the summer rolled around, we were told everybody can go get tested, just go get tested. We want to see how many people have COVID-19. Now, recently, once again, it's been changed, like you said, and you're only supposed to go if you're showing new or worsening symptoms. So, of course, it's a little bit confusing, and one of our viewers wanted to know why we've stopped testing asymptomatic people if we still feel that people without symptoms are contagious. So here's what the doctor had to say about that.
Asymptomatic testing is still going on, actually. It's just that it's defined asymptomatic testing. And what I mean by that is if you were a contact of a case, if someone you know who you were close with got COVID, we will recommend that you get tested even if you don't have symptoms. And if they become positive, that would be counted as an asymptomatic case. So it's trying to really test those who are asymptomatic who are more likely to be positive. And then you're gonna pick up more of them.
So another thing that the doctor actually said was when they were allowing everybody to get tested, some people were kind of using that irresponsibly and taking a negative test to mean that they could now go party or go to the cottage with friends. And that's really not a great use of the resources. Plus, now with schools opening up, you know, lots of students have to get tested. So they really want to reserve the lab capacity for that kind of testing.
Yeah, I mean, I feel like it changes every day with their approach and what they're doing. But that being said, how do you keep up with all of it? There's still going to be a section of the population that remains asymptomatic that still is carrying this virus that could potentially still be spreading it. I get that they've got to balance all of that, though. But you've been doing this, Dee, for about 6 months, the whole Ask Me Anything. You've been getting a lot of intriguing questions from viewers. Is there anything, though, that has surprised you in all of these findings?
You know, what's really interesting is nothing from the viewers or listeners really surprised me. I know that our audiences are really smart. People have tons of information coming at them from all sorts of different sources. So I fully expected them to question, you know, our government officials and have really smart questions for them. What kind of surprised me actually was more on a personal note. You know, we work in news. Anxiety is heightened at this time. And I almost felt that this regular barrage of information would actually heighten my anxiety even further. What it's actually done for me is calmed me down a little bit because I really feel like knowledge is power, you know? So you keep up with all of the developments, you get all of these really in-depth answers directly from a government official. It's kind of helped me calm down, and that was a really pleasant surprise for me.
Yeah, you've got a direct line now to Toronto Public Health, which is nice, right? Dee, as always, we appreciate your time.
And thank you so much. And I just wanted to add, if people would like to submit their questions for next session, we've got that article up right now on citynews.ca/COVID answers. Plus, we've got a top 10 most frequently asked questions over this past 6 months, so people can check that out. And I'll have more with the doctor on City News at 5 and 6 today.
Good stuff. Dilshad Burman, thank you so much.